Eletriptan Hbr tablet is used to treat migraines. It helps to relieve headache, pain, and other migraine symptoms, including nausea, vomiting, and sensitivity to light and sound. Prompt treatment with Eletriptan Hbr tablet can help you return to your normal routine and may decrease your need for other pain medications. This medication belongs to a class of drugs known as triptans, which work by affecting a natural substance in the brain called serotonin, causing the narrowing of blood vessels. Eletriptan Hbr tablet may also relieve pain by affecting certain nerves in the brain. It's important to note that Eletriptan Hbr tablet does not prevent future migraines or lessen how often you get migraine attacks. The recommended dosage for Eletriptan Hbr tablet is usually 1 tablet taken as soon as you experience migraine symptoms. It's important to follow the instructions provided by your healthcare provider. Always take Eletriptan Hbr tablet with a full glass of water. If your symptoms do not improve or worsen after taking this medication, contact your healthcare provider for further guidance. It's important to take Eletriptan Hbr tablet as soon as possible after the onset of a migraine for the best results. Before taking Eletriptan, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth with or without food, as directed by your doctor, at the first sign of a migraine. The dosage will be determined by your medical condition and how you respond to treatment. If your symptoms don't improve, don't take more doses without consulting your doctor. If your symptoms are only partially relieved, or if your headache returns, you may take another dose 2 hours after the first one. For the US product, do not take more than 80 mg in a 24-hour period. For the Canadian product, the manufacturer recommends a maximum of 40 mg in a 24-hour period. If you are at a higher risk for heart problems, your doctor may perform a heart exam before you start taking Eletriptan. They may also have you take your first dose in the office to monitor for serious side effects, such as chest pain. If you are using drugs for migraine attacks on 10 or more days each month, these drugs may actually make your headaches worse. Do not use medications more often or for longer than directed. If you find that you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse, be sure to talk to your doctor. Some common side effects of Eletriptan Hbr tablet may include nausea, tingling/numbness, weakness, tiredness, drowsiness, or dizziness. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Eletriptan Hbr tablet may also raise your blood pressure. It's recommended to monitor your blood pressure regularly and notify your doctor if the results are high. Tell your doctor right away if you experience any serious side effects, such as blue fingers/toes/nails, cold hands/feet. It's important to note that Eletriptan can cause chest/jaw/neck tightness, pain, or pressure, which is usually not serious. However, these side effects can mimic symptoms of a heart attack. If you experience chest/jaw/left arm pain, shortness of breath, or unusual sweating, seek medical help immediately. Other serious side effects may include fast/irregular heartbeat, fainting, severe stomach/abdominal pain, bloody diarrhea, or signs of a stroke. This medication may also increase serotonin and rarely cause a serious condition called serotonin syndrome/toxicity. The risk of this condition increases if you are taking other drugs that increase serotonin. If you develop symptoms such as fast heartbeat, hallucinations, severe dizziness, or severe nausea/vomiting/diarrhea, seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA. In Canada, you may report side effects to Health Canada. Before taking Eletriptan Hbr tablet, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history with your doctor, especially if you have any blood circulation problems, certain types of headaches, heart problems, liver disease, seizure, stroke, or mini-stroke. Certain conditions can increase your risk for heart problems, such as high blood pressure, high cholesterol, diabetes, family history of heart disease, being overweight, smoking, being postmenopausal, for women, or being over 40 years old, for men. Eletriptan can make you feel dizzy or drowsy. It's important to avoid alcohol or marijuana while taking this medication, as they can increase these effects. It's also important to avoid driving or using machinery until you know how this medication affects you. Before having surgery, make sure to inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. The risk of heart disease and high blood pressure increases with age, so older adults may be more sensitive to the side effects of this medication. If you are pregnant, it's important to discuss the risks and benefits of taking this medication with your doctor. This medication can pass into breast milk, so it's important to consult your doctor before breastfeeding while taking Eletriptan Hbr Tablet. When taking Eletriptan Hbr Tablet, it's important to be aware of potential drug interactions that can affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain medications that can affect the removal of Eletriptan from your body within 72 hours of taking Eletriptan. Examples include cobicistat, nifazodone, ribociclib, ritonavir, azole antifungals, such as ketoconazole, itraconazole, macrolide antibiotics, such as clarithromycin, erythromycin, HIV protease inhibitors, such as nalfinavir, among others. If you also take any ergotamine medication, such as dihydroergotamine, or other triptan drugs, such as sumatriptan, rizatriptan, separate your Eletriptan dose at least 24 hours apart from your dose of these other medications to lessen the chance of serious side effects. The risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin. Examples include street drugs such as MDMA/ecstasy, St. John's wort, certain antidepressants, including SSRIs such as fluoxetine/paroxetine, SNRIs such as duloxetine/venlafaxine, among others. The risk of serotonin syndrome/toxicity may be more likely when you start or increase the dose of these drugs. If someone has taken too much Eletriptan Hbr Tablet and is experiencing severe symptoms such as loss of consciousness or difficulty breathing, it is important to seek immediate medical assistance by calling 911. Alternatively, contact a poison control center for guidance. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important not to share this medication with others. Certain foods, beverages, or food additives, as well as lifestyle patterns such as irregular eating/sleeping habits or stress, may bring on a migraine headache. Avoiding these triggers may help lessen migraine attacks. It's best to consult your doctor for more details on managing these triggers. Your doctor may recommend lab and/or medical tests, such as checking your blood pressure, while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. Eletriptan Hbr Tablet is used to treat migraines. It helps to relieve headache, pain, and other migraine symptoms, including nausea, vomiting, sensitivity to light/sound. This medication helps to reduce the symptoms of a migraine. Taking this medication as soon as migraine symptoms appear may help to relieve the headache pain. The usual dosage is 20 mg at the first sign of a migraine, with or without food. If the migraine returns after an initial dose, you may take another dose at least 2 hours after the first dose. Do not take more than 40 mg in a 24-hour period. If you have certain health conditions, you may need a lower dose or special instructions. Follow your doctor's instructions carefully. It is important to take this medication as soon as you feel a migraine headache starting. Take this medication by mouth with or without food as directed by your doctor, at the first sign of a migraine. The best time to take this medication is as soon as you feel a migraine coming on. When using Eletriptan Hbr Tablet, it's important to store it at room temperature, away from light and moisture. Be sure to keep it in a place where children and pets can't access it, and avoid storing it in the bathroom. When it comes to disposing of the medication, never flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult with your pharmacist or local waste disposal company to properly discard this product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.